Bill Gates and the UN have been quietly planning to usher in Operation Catastrophic Contagion, according to a new report from InfoWars founder Alex Jones. Potential pandemics, secret plans, and dire warnings. Let's take a look, shall we? Hello and welcome. This is Patrick Christys for GB News Originals. Now, before we go any further, let's just remember that Alex Jones isn't exactly known for his restraint when it comes to conspiracy theories. However, given the current global health situation, it's worth examining these claims. Jones warns that this alleged plan involves unleashing the human, here we go, metapneumovirus, or HMPV, on the general public. Now, it's quite a claim, and it's important to note that there's no concrete evidence to support this. However, it does tie into some very real events that are happening right now. While we're pondering hypothetical scenarios, there is a real situation unfolding in China at the moment. A respiratory illness identified as HMPV is spreading, and it's raising some very serious concerns. Chinese authorities have reported a significant increase in HMPV cases, particularly among children under 14 in the northern parts of the country. What's truly alarming is the footage circulating on social media. We're seeing videos of overcrowded hospitals, long lines of parents holding coughing children, all waiting to get into paediatric units. It's a scene that's eerily reminiscent of the early days of the COVID-19 pandemic. But what is HMPV? For those of you who aren't familiar with it, it's a respiratory virus that typically causes mild cold-like symptoms. We're talking about coughing, fever, nasal congestion, and shortness of breath. Now, for most people, it should be no worse than the average winter cold. However, it can cause more severe issues like pneumonia and bronchitis, especially in young children, the elderly, and those with weakened immune systems. What is the situation in China, though? Well, it appears to be very serious indeed. The sheer number of affected children is particularly concerning. It's a stark reminder of how quickly these viruses can spread, especially in densely populated areas. But let's shift our focus to a rather chilling prediction made by Dr. Peter Hotez. For those who don't know, Dr. Hotez was a prominent figure during the COVID-19 pandemic, advocating strongly for the mRNA vaccines. Last month, he made an appearance on MSNBC that's got a lot of people talking. Dr. Hotez made a suspiciously specific prediction. He warned that new pandemics will be starting on January the 21st. And here's the kicker. That's the day after the potential inauguration of President Trump. Well, there we go. But it doesn't stop there. Dr. Hotez went on to say that multiple deadly virus outbreaks will come crashing down on the Trump administration as soon as he's sworn back into office. Let's take a little look at this interview.
Here's the reason why we need to care about this stuff, Nicole, is that we have some big picture stuff coming down the pike starting on January 21st. Mr. Bloomberg mentioned H5N1. That I'm really worried about. It's all over wild birds on the western part of the United States and going up in the north. It's getting into the poultry. We're seeing sporadic human cases, no human-to-human transmission yet, but that could happen. It's in the cattle, it's in the milk, and that's just the beginning. We have another major coronavirus likely brewing in Asia. We've had SARS in 2002. SARS-2, COVID-19 in 2019. And we know these viruses are jumping from bats to people thousands of times a year. But there's still more. We know that we have a big problem with mosquito-transmitted viruses all along the Gulf Coast, where I am here in Texas. So we're expecting dengue and possibly Zika virus coming back, or a Puche virus, maybe even yellow fever. And there's more. Then we have all this sharp rise in vaccine preventable diseases going up because of, in part, the anti-vaccine activism that's so prominent right now. We have a five-fold rise in pertussis cases, whooping cough over the last year, 15 measles outbreaks this year. We've got polio that's been in the wastewater in New York State. All that's going to come crashing down on January 21st on the Trump administration. We need a really, really good team to be able to handle this.
So we have Alex Jones claiming that Bill Gates and the UN are planning to release HMPV on the public. We have a real HMPV outbreak happening right now in China, with other cases reported across the world as well. And we have Dr. Hotez predicting multiple pandemics starting on a very specific date that coincides with the potential change in US and arguably world leadership. Is this all just a series of coincidences, do we think? Or is there something more going on here? The claims made by Alex Jones are, as of now, unsubstantiated. The HMPV outbreak in China is happening, but it's not unprecedented. Respiratory illnesses do often spike during the winter months, and as Dr. Hotas' predictions, well, only time will tell if they come to pass. But viruses don't care about political boundaries or election dates. They spread when conditions are right, regardless of who's in office. The idea that multiple pandemics would conveniently start on the day of a presidential inauguration does stretch credibility. What we're seeing here is a perfect storm, though, of fear, speculation, and very real health concerns. It's a potent mix that could easily lead to panic if we're not careful. On one hand, we have claims of secret plans and ominous predictions that sound like they're straight out of a conspiracy theorist handbook. On the other hand, we do have a very real outbreak happening in China that's causing genuine concerns. And let's be honest, we are coming off the back of a COVID outbreak, which did prove, in some cases, conspiracy theories could actually be true. The truth, as always, probably lies somewhere in the middle. We shouldn't dismiss all warnings as fearmongering, but we also shouldn't jump to conclusions based on unverified claims. The COVID-19 pandemic taught us that global health crises can emerge suddenly, have devastating consequences, but it also taught us the importance of relying on verified information and trusted health authorities, although sometimes those health authorities did prove to not be that trustworthy at all. As we navigate this complex landscape of health threats and alarming predictions, it's crucial we keep our wits about us. Yes, there are those real health concerns, and we need to be aware and prepared for them. The HMPV outbreak in China is a stark reminder that new viruses can emerge and spread rapidly. However, we also need to be cautious, I think, about claims of grand conspiracies or politically timed pandemics. We also need to be cautious, certainly legally, when it comes to accusing Bill Gates of actually being responsible for anything. But these kind of assertions often serve to divide us and distract us from the real work of pandemic preparedness and response. But what's clear is this: the threat of pandemics will remain a part of global reality for the foreseeable future, whether it's HMPV, a new strain of influenza, or something we haven't even discovered yet. We need to be ready.